Hey everybody, this is Griffin from the North Star Body, where we use physiology and biomechanics to help you sort out stress, anxiety, chronic joint pain, and anything else that might be getting in the way of you living a happy and active life. Last week in our car video, we talked about stretching and it not being a long-term solution to back pain specifically. And today we're going to elaborate on that a little more and talk about what's the right kind of flexibility that we want to have, and can you have too much flexibility? So when we use terms like range of motion, all that means is how far a joint can move. So the easiest example to use is the bicep and the elbow joint, because it's just so straightforward. So a muscle can lengthen and it can contract, and it anywhere in between. And so how much it can lengthen and contract is its range of motion, like how far it can go. So with the elbow joint, my bicep contracts and shortens, and that bends the elbow joint. And then when this muscle lengthens, it allows the elbow to straighten. And so this would be full range of motion of the bicep. If somebody can't straighten their elbow all the way, they have limited range of motion, and it's likely because the bicep can't lengthen all the way. So maybe it can shorten all the way, but then it can't lengthen past here, so the elbow can't straighten anymore. That would be somebody with limited range of motion. This applies to any tissue or joint in the body. Now, the tricky part is there's a passive range and there is an active range. So this would be a passive range of motion. Passive just means how far can the joint go, but active range means how much can that tissue lengthen while continuing to hold tension. And that's really, really important to distinguish between the two. So if you look at these rubber bands, right, I've got sort of a stronger one, and I've got like a floppy one. So this one can get pretty long and hold, there's a little tension because I'm pulling it, but it's still pretty kind of floppy, right? And so it can be pretty long, but it's all stretched out and sort of flaccid. Whereas when this one, when I stretch it, it's still got a lot of tension. It's like wants to snap kind of right back into place. So this would represent active range of motion because it can stretch, but there's still a lot of tension. There's a lot of elastic potential there. Whereas when I pull this one, I feel like it's just going to break. There we go. It just broke. So there's a difference between how far can this muscle lengthen, but can I keep tension? And that could be represented by if you're holding a weight. Can you hold the weight? I'm pretending that I'm shaking, holding a weight, while that bicep lengthens. I don't recommend you try this if you've never tried it, because if your bicep can't handle it, you could hurt yourself. So a muscle that can handle tension at length can definitely handle it in a more shortened position. If you try a bicep curl, it gets way harder as you lengthen the arm. The opposite isn't true. So just because I can hold a weight here doesn't mean I can hold it out here. And so if my active range is limited, then when I get here, I either have to drop the weight or just kind of flop my arm down, or I'm going to get injured. You know, I'm going to pop the bicep tendon out or tear the muscle. And so just because somebody can stretch a muscle really long doesn't mean that they can hold tension while they're doing it. Now, every muscle in the gait cycle, which is the walking and the running pattern in the human body, has a specific length that it should more or less lengthen to under tension before it hands off the action to another joint. Yes, you can have too much flexibility. So there are sort of stages of schools of thought. The traditional flexibility folks would say being more flexible is better, right? Just passive flexibility. So I can bend over and touch my toes, my hamstrings get nice and long, there's no resistance there, and that's good for me. I disagree with that. Then there are slightly more progressive schools of thought that say, well, you need active range. So maybe you're bending over like a Jefferson curl and you have weight while you're bending over to touch your toes. And it's like, we want to get as big a range of motion as we possibly can while under tension. But I also disagree with that, because if the body doesn't know when to stop lengthening, then it's not going to know when it's the other joint's turn, the other muscle's turn to take over the action. So I'll give you an example. if I train myself to be able to hold a lot of weight and to bend over and touch my toes, and my hamstrings learn to lengthen and my low back learns to lengthen to extreme ranges under tension, full range of motion, a lot of people would say, well, that's a good thing. The more active range, the better. But the reason I disagree is because when we run and when we pick up the leg in the stride, so the leg that's coming up and forward that we're rotating towards, if that hamstring and that low back don't know when to stop lengthening because we've trained our neural pathways and we've trained our tissue under load and tension to keep lengthening and get as flexible as possible, when we pick up that leg, it's going to keep going up way past the point where in a really good running pattern, it would stop and then fire back and the leg hits the ground to continue the pattern. So now somebody who lengthens their hamstrings and their low back excessively with weighted forward folds, for example, are going to possibly end up picking their legs up too high and their pelvis tilting too much, like tucking under too much, the knee coming up and the hamstring lengthening too much, and not being able to re-engage and find the tension that it needs to complete the running cycle. When you start to add force to muscles that aren't designed to handle it, you eventually will probably get injured. I'm not saying everybody who trains a certain way is definitely going to get injured. That would be silly. But a lot of people argue that they should train the length, the full range of motion under tension, a full active range, because you want to be able to feel safe in that position. And so if you end up in that position, you're not going to get injured. And I would agree that if you're training these extreme ranges and once in a while you find yourself in an extreme range and you know how to handle it, that's good. But what's more likely to happen is that those extreme ranges are going to increase range of motion for your daily movement in not such a good way. The example that I just gave with the long hamstring and low back muscles affecting the way you run. What's more likely? For most people, it's not that you're going to find yourself in this crazy contorted position and thank God you trained it with some weight. It's going to be that you're walking every day, maybe you're running every day, you're playing a sport or a hobby, and that every single rep of movement that you do, you've got slightly too much range of motion, and the wear and tear on a range that's really not designed to handle those repetitive forces eventually breaks you down. Again, not trying to scare anybody, but just saying that there's a more intelligent way to go about training strength at length. So we have to understand how long the tissues, more or less, are supposed to be handling tension, creating tension and handling force. We train them to that length. So we do want strength at length. We do want active range of motion. We do want to be able to hold tension in the tissues as they get longer and stretch out, so that when they do get longer, we don't just collapse, start to compensate, and dump all our force, right? We're still able to resist pressure and maintain that, but only to a certain degree. We don't want to go past that certain degree. So my recommendation is to look into some gait-based training. As you all know, I use and coach One of a Kind Fitness because that's exactly what we look at. We look at the gait cycle. We look at how long these tissues are supposed to get. We work on progressively adding load to the muscles and the tissues at this length so that when we walk or we run, we handle force at the length we need to, and then no more than that, so it transfers to the next joint when it needs to, and we have a smooth, athletic, pain-free gait cycle. And hopefully that translates into your sport, your hobby, or whatever you like to do with movement. So hopefully this clears up what range of motion is, what flexibility means, active versus passive, what matters and how much of it matters. If you liked this video, please like it literally with the like button. Share it with somebody who needs to hear this. Subscribe to the channel if this type of stuff interests you.